A warm welcome to all of my students. Welcome to my channel, Microbiology Tutorials. Today I am going to discuss about the measles virus. The measles virus belongs to the family Paramyxoviridae, which contains important pathogens of infants and children responsible for a major part of acute respiratory infections, respiratory syncytial virus, and parainfluenza virus, and also for two of the most contagious diseases of childhood, measles and mumps. Though much less common infection may also occur in adults. So here basically the Paramyxoviridae family contains respiratory syncytial virus and parainfluenza virus, including two contagious, or we can say which can easily spread from one person to another, that is the of childhood diseases, is the measles and mumps. So today I'm going to discuss about the measles virus. Before going to that, I would like to share some of the important properties of the paramyxoviruses. So paramyxoviruses resemble orthomyxoviruses in morphology but are larger and more pleomorphic. They are roughly spherical in shape and range in size from 100 to 300 nanometers, sometimes with long filaments and giant forms of up to 800 nm. The helical nucleocapsid is much wider than in orthomyxovirus with a diameter of 18 nm. The genome is molecule of linear single-stranded RNA, so it is a RNA virus. Unlike the orthomyxovirus, in which the segmented nature of the genome facilitates genomic reassortments and antigenic variations, so typical of influenza virus, the paramyxovirus with their unsegmented genome do not undergo genetic recombinations or antigenic variation. Hence, all paramyxovirus are antigenically stable. Next, the nucleocapsid is surrounded by a lipid envelope which has the matrix protein in its base and two types of transmembrane glycoproteins, spikes at the surface. The longer spike is the heme agglutinin, which may also possess neuraminidase activity, and hence it is known as H or HN protein. It is responsible for absorption of the virus to the host cell surface. The second spike is the F or fusion protein, responsible for fusion of the viral envelope with the plasma membrane of the host cells, which is essential early step of infection. It also brings about cell-to-cell fusion causing large giant cells or syncytia, which are characteristics of paramyxovirus infections. The F protein also mediates the hemolytic activity of paramyxovirus. The family Paramyxoviridae is divided into four genus: rubella virus, parainfluenza virus, morbillivirus, and pneumovirus. So family Paramyxoviridae have four genus: rubella virus, which contains the mumps virus. Then comes the parainfluenza virus. Parainfluenza virus has been identified. Four types has been identified. That is the parainfluenza virus type 1, parainfluenza virus type 2, parainfluenza virus type 3, and parainfluenza virus type 4. Next is the genus, again in the here genus in the pneumovirus, there is a respiratory syncytial virus, and in the genus morbillivirus, the measles or rubella virus is present. So these are some of the important characteristics of the family Paramyxoviridae, and it contains a varied form of genus, and most of them are responsible for the respiratory infections in mostly in the child, and some of them also infecting the adults. Here we concentrate on the genus, that is the morbillivirus, and this morbillivirus is also known the virus as the measles or rubella virus. So first, coming to the history part here, I would like to discuss that it is a highly contagious viral disease transmitted by aerosols through human to human contact. It is often considered as a benign disease, although mortality remains high in developing countries, that is more than 5%. Frequent complications is diarrhea, otitis, pneumonia, and encephalitis also can be observed. The disease mainly affects young children from 5 to 6 months of age, with a mortality peak in the first 3 years of life. The Persian physician Rhazes gave the first clinical description of the disease in the 10th century, clearly differentiating it from the smallpox. Measles spread worldwide from the period of Renaissance. So when the new world started and people started to travel from one place to another, they slowly the it started to spread. Earlier, it was confined to some parts of the world. Now here, I would like to add that though it is an ancient disease, but for a long time, no clear distinction was made between measles and other exanthematous diseases, including smallpox. It was only in 1629 that measles came to be considered a separate entity, and Thomas Sydenham in 1690 gave the first clear and accurate description of measles in the English language. In 1846, an outbreak of measles occurred in the remote Faroe Island, affecting 75% of the islanders. The classical study of the epidemic by Peter Panum, a Danish medical student, laid the basis of our scientific knowledge about the measles. So the first proper study was made by the Danish physician, that is Peter Panum, during the epidemic in the Faroe Islands, and the viral nature of the disease was demonstrated in 1911 by Goldberger and Anderson by transmitting the disease to monkeys through the inoculation of filtrates of blood and nasopharyngeal secretions from patients. The virus was isolated in monkey and human kidney cells by Enders and Pebbles in 1954. So it is a morbillivirus family, Paramyxoviridae, also responsible for rinderpest, distemper, and epidemic disease of the dolphins, porpoises, and seals. The current measles virus appeared recently from the rinderpest virus from the 6th century BC. So these are some of the important historical aspects of the measles virus. Next, a live attenuated vaccine was developed in 1958 by Enders and Peebles in 1954. First of all, it was isolated by Enders and Peebles in 1954, and the vaccine was developed in 1958 by Enders' team after numerous passages in cell culture. The vaccine was licensed in the United States in 1963 and used on a large scale by WHO throughout the world. The highly effective and well-tolerated vaccine has greatly reduced the number of measles cases and saved millions of lives. Measles remains a major public health concern, causing over 1 lakh deaths per year worldwide. Today, the most affected continents remain Africa, South America, and Asia. So the scientific name for the measles is Measles morbillivirus, which belongs to the genus Morbillivirus within the family Paramyxoviridae. It is commonly referred to in medical literature as the measles virus, or sometimes by the older designation Morbillivirus hominis. So if we go for taxonomic classification and pathogenic details, so we can say that it is the genus is a morbillivirus of the family Paramyxoviridae. Type is a single-stranded negative sense enveloped RNA virus. So here the term negative sense basically means that when the virus starts multiplying, first it converts to the positive sense RNA, and after the conversion into positive sense RNA, then it starts forming the structural or the basic proteins is required essential for the virus multiplication and its assembly. So it is distinct from basically usually we confuse with the rubella or German measles, but it is distinct from the rubella virus, and it is called as the rubiola. So rubella is the German measles, whereas rubiola virus causes measles virus, which we are currently discussing. Characteristics is highly contagious, spreading through respiratory droplets. The virus causes severe respiratory and systemic infection, commonly known as rubella or simply measles. Here, I'm showing the structure of the measles virus. This is the electron microscopic structure of the measles virus, whereas this is the diagrammatic representation through which you can see here that it is basically an enveloped virus, whereas the outer capsid contains two proteins, that is the heme agglutinin protein, which is colored by yellow color, and another is the fusion proteins. Then inside you can see that there is a polymerase enzyme and which helps in the replication of the DNA nuclear material. Then again here it is a phosphoproteins. Then the next here you can see there is a nucleocapsid. If I further elaborated in the next diagram, you can easily see here that there is a one H protein, which is hemagglutinin protein, then fusion or F protein. Then there is one M protein is present there, and further you can see the other structures here also. So with this we can easily differentiate, or we can easily elaborate the through the diagrammatic representation the structure of a measles virus. Here you can see that how the replication takes place. So here, first of all, there is a attachment to the receptor present on the host cells. And here you can see that CD46 or Nectin-4, SLAM or CD140 are the receptors through which these viruses attaches to it. And it after the activation of fusion protein, there is a conformational changes in the virus, and finally the fusion of the virus takes place inside the host cells. After that, uncoating of the envelope takes place, and the nucleocapsid is released into the host cells, which is present as a which is the genomic structure, and it is single-stranded RNA structure. Now here you can see that from the same, either the replication means that from one copy to multiple copies of a single-stranded RNA genome will take place in one pathway, or in the second pathway you can see that there is a primary transcription, means that these RNA first convert them into positive sense RNA, or we can say proper that they are now positive sense RNA. Unless and until they are not converted into the positive sense RNA, they will not able to synthesize the viral proteins. So there is a primary transcription where negative sense RNA is converted to positive sense RNA, and after that they are processed in the Golgi complex and in the endoplasmic reticulum. Or second pathway is there that they may directly convert into viral proteins. And after that, you can see here that there are two pathways that when they are translated into proteins, there is a protein trafficking, means that same protein goes outside in the form of fusion and hemagglutinin protein, or next pathway is the secondary viral proteins. It is involved in the formation of secondary protein of the envelopes. They are assembled in an envelope-like structures, and finally there is assembly of the entire genome inside the capsid, inside the envelope, and they are released through the process of budding. So this is the basically the structure, the replication pathway, or the entire cycle of the virus which takes place in an host cells. So here you can say that it is a multi-step cytoplasm, and the replication is take place in the cytoplasm of the host cells, not in the nucleus. So virus binds to the cell receptors via its heme agglutinin. The fusion proteins then merges the viral envelope with the host cell membrane, releasing the ribonucleoprotein core into the cytoplasm. Then transcription and replication takes place. The viral RNA-dependent RNA polymerase transcribes the negative sense genome into positive sense mRNA, and the ribosomal dependent RNA polymerase then replicates the negative sense RNA into a full-length positive antisense genome, which serves as a template to generate new negative sense viral genomes. Assembly and release: viral proteins and new genomes assemble at the plasma membrane. New virus exit the cell, often causing cytopathic effects. Now, coming to the difference, what is the major difference between the measles and German measles, that is the rubella? You can here see that measles virus is a paramyxovirus. It belongs to a paramyxovirus category, whereas rubella virus is a toga virus. Here, the symptoms basically appears as a red and blotchy, starts at hairline, spreads, and it spreads down. And here, fine pink spots starts on face and spreads down. Here, high fever, often 104 degree Fahrenheit or higher. And in the rubella, there is a mild fever and it rarely exceeds 101 degree Fahrenheit. So it is important to distinguish between the rubella and rubeola, that is the measles. So rashes in the German measles is light pink rash spreads from face downwards. Whereas in the measles, there is a bright red rash that spreads from face. Both have the characteristics feature is the rashes which are present, and both here spreads from the face part to the downwards, but only the difference is that in the rashes in the German measles is light pink, whereas in the measles it is bright red. Other symptoms is mild fever, swollen lymph nodes, joint pain. Here high fever, cough, red eyes, and Koplik spots are present. Severity mild in children but dangerous in pregnancy. More severe and cause pneumonia and encephalitis. Contagious period is 7 days before and after rash. Whereas in the measles, it is the period is 4 days before and after rash. Replication of German measles, rubella virus replicates in the cytoplasm and is classified under toga viridae. And genome it consists of a positive sense and single stranded RNA virus. So remember that the measles, or morbillivirus, is a negative sense single stranded RNA, whereas the German measles is a positive sense single stranded RNA. Upon entering the host cells, the positive sense RNA genome acts directly as a messenger RNA and is translated into viral protein. So here it does not have to, first of all, go under primary transcription and convert it into a positive sense RNA. It will directly act as a messenger RNA and it will translate into viral proteins, including the ribosomal dependent RNA polymerase. The enzyme then replicates the RNA via negative sense intermediate, creating new positive sense genomes. Replication strategies: the rubella virus replication commonly induces severe abnormalities. If infection occurred during pregnancy, that is also called as congenital rubella syndrome, often to leading to often leading to chronic infection in the fetus. See here, you can see the condition here. Pink, bright red spots. In this is the case of measles. Here, bright red spots you can easily observe on the face of the child, and red, purple, or brown depending on the skin color, and it may change upon the depending on the skin color, and it is most often first show up on the face and behind the ears. The rash then spreads to the chest and back, and finally to the feet. See, some of the other symptoms include that is high fever, then sore throat, tiredness, cough, runny nose, red spots in the mouth, rashes, red or bloodshot eyes, diarrhea, stomach pain or vomiting, muscle aches, and headache. So measles is more than a rash. It can cause severe symptoms and lead to life-threatening complications like encephalitis. Now here CDC recommends, so for coming to the live diagnosis, before discussing the live diagnosis, Here, I can also address some of the important clinical features that it takes about 9 to 11 days from the time of exposure to infection for the first signs of clinical disease to appear. These consist of prodromal malaise, fever, conjunctival infections, cough, and nasal discharge. After 3 to 4 days of prodromal illness, the rash appears. A day or two before the rash begins, cochlear spots develop on the buccal mucosa and occasionally on the conjunctiva and intestinal mucosa. The prodromal illness subsides within a day or two of the appearance of the rash. The red maculopapular rash of measles typically appears on the forehead first and spreads downward to disappear in the same sequence 3 to 6 days later, leaving behind a brownish discoloration and finally granular desquamation. Most patients recover uneventfully, but quite a few develop complications, which may be due to the virus, that is the croup or bronchitis, or to secondary bacterial infection, pneumonia or otitis media. Rarely, the virus may cause a fatal giant cell pneumonia, particularly in children with immunodeficiencies or severe malnutrition. Complications are more common and serious in the developing countries. The most serious complications is meningoencephalitis. See, usually when we discuss about complications, so it is mostly the complication. The major complications include that this is not included in the pathogenesis. So they are the respiratory viral infections, but due to their severity, they may cause damage or they may cause some disorder in the other body parts. And here, one of the most important complication is the neurological sequel. And here, a rare complication is subacute sclerosing panencephalitis. So, encephalitis may occur if the disease progresses or it more and it is left uncured. Now, what happens that next is another complication is protracted diarrhea is often seen as a complication in children. In the poor nation, the virus may be recovered from the stools of patients with measles enteritis. Next, there occurs a suppression of delayed hypersensitivity after measles infection, which may last for weeks or several or a few months. Montaux and other allergic skin tests may be negative during this period. Underlying tuberculosis may become worse following an attack of measles. So it can act as a secondary infection also, and it may trigger other pathogens, especially the tubercular in the patient suffering from tubercular infections. And their recovery from measles may also be associated with an improvement of allergic eczema or asthma, Hodgkin's disease, or lipoid nephrosis. Measles induces labor in some pregnant women, resulting in spontaneous abortion or premature delivery. The virus may cross the placenta and infect the fetus during maternal measles, but there is no evidence of teratogeny. Thrombocytopenia may develop, leading to purpura and bleeding from the mouth, intestine, and genitourinary tract. So the basically the mode of infection, the virus enters, as we know that it is an aerosolized infection. It enters the body through the respiratory tract or the conjunctiva and multiplies locally and in the adjoining lymph node. The virus spreads to the reticuloendothelial system through the blood. After multiplication, there is secondary viremia transports the virus to the epithelial surface, including the skin, mouth, respiratory tract, and conjunctiva. The pathognomic Buccal spots, which are small bluish white ulcerative on the buccal mucosa, opposite the lower molar, contain giant cells, cytoplasmic and intranuclear inclusions, and virion components indicating local viral replication. Evidence of viral replication can also be seen in the cells vascular endothelial cells at the sites of the skin rash. The rash represents an immune reaction between T lymphocytes and cells and immune reactions between and cells in which viral replication is taking place. Now coming to the laboratory diagnosis part. So in a typical case of measles, the diagnosis is self-evident. In atypical case and for differentiation from rubella, laboratory tests are useful. A simple diagnostic test which can be used even before the rash appears is the demonstration of multinucleated giant cells in giemsa-stained smears of nasal secretions. The measles virus antigen can be detected in these cells by immunofluorescence. The virus can be isolated from the nose, throat, conjunctiva, and blood during the prodromal phase and up to about 2 days after the appearance of the rash. So basically, these are some of the important tests which can help in the diagnosis. And the virus may be obtained from the urine of a few more days. Primary human or monkey kidney and amnion cells are the most useful for cell cultures. Cytopathic changes may take up to a week to develop, but earlier diagnosis of viral growth is possible by immunofluorescence test. Serological diagnosis, specific neutralization, heme agglutination inhibition, and complement fixation antibodies develop early. A fourfold rise in titer is looked for using sera collected during the acute phase and 10 to 21 days later. Demonstration of measles-specific IgM in a single specimen of serum drawn between 1 or 2 weeks after the onset of the rash is confirmatory. False negatives may occur if the serum is taken earlier than 1 week before or later than 2 weeks after the onset of the rash. Demonstration of high titer measles antibody in the CSF is diagnostic of subacute sclerosing panencephalitis. Now coming to the prophylactic part. So here the vaccines has been developed and it is given during the early period of childhood. And in the case of prophylaxis, normal human gamma globulin given within 6 days of exposure can prevent or modify the disease depending on the dose. This is valuable in children with immunodeficiency, pregnant women, and others at special risks. A safe and effective live attenuated measles vaccine is available. The original live vaccine uses the Edmonston strain developed by multiple passage through human kidney, amnion, and chick embryo cultures. Due to its high risk of causing febrile rashes, further attenuation became necessary. The Swartz and Moreton strains so developed were safe but effective only in children older than 15 months. In the tropics, measles is common and serious in children below 12 months. Therefore, the Edmonston Zagreb strain attenuated by passage in human diploid cells is preferred as the vaccine strain because it is able to produce seroconversion even in infants 4 to 6 months old. The recommended age for measles vaccinations in the developing countries is now 9 months, while in the advanced nation it remains 15 months. The vaccine is given either by itself or in combination as the MMR vaccine. A single subcutaneous injection of the measles vaccine provides protection beginning in about 12 days and lasting for over 20 years. Contraindication are immunodeficiency, untreated tuberculosis, and pregnancy. A live attenuated vaccine has been developed which can be given by intranasal aerosols in young babies and gives good protection irrespective of the presence of maternal antibodies. Efforts are being made to eradicate measles via vaccination. Considerable progress has been achieved in the USA and some other countries. So these are some of the important aspects of the measles virus. And with this, I conclude my lecture. I hope it would have benefited you in increasing your knowledge about the measles. If you liked my the lecture, please like and subscribe my channel so that I remain motivated and brings more videos, educational videos and information for you. Thank you.